November elections are around the corner, and one of the important issues that Harris County voters will need to decide is whether to authorize a $2.5 billion bond for the county's safety net public healthcare system. Our guest today in TLC Live, Dr. Porsa, President and Chief Executive Officer of Harris County Healthcare System.
Well, good morning.
Good morning. Welcome to TLC Live as every Wednesday. I'm Andrea Gomez.
And I'm Orlando Sanchez. As Andrea said, we have a very important election coming up. Of course, all elections are important, but this one in particular. As you know, I rarely have supported massive bond issues unless they deal with infrastructure and public safety. And we have Dr. Porsa, who's the CEO of Harris Health, which is our community hospital that's funded through your property taxes through Harris County. And most people know Harris Health through Ben Taub, a level 1 trauma center. And we're going to talk about the need for enhanced trauma centers in Houston. But I will tell you that early in my life, I served as a volunteer emergency medical technician on the east part of Harris County. And that was in the 80s. We had 2 level 1 trauma centers for adults. So they were both co-located in the med center. What does that mean? That means if you're in the far outreaches of Harris County, you have to be transported. If you're lucky enough and we have clear skies, Life Flight may come pick you up and take you to Memorial Hermann, or, you know, if they have a helipad, they probably share the helipad. You can go to Ben Taub. But unfortunately, as the city has grown, so has the demand for level 1 trauma care. And unfortunately, we're so busy that on many occasions, our level 1 trauma centers are on what we call drive-by status. There's just no capacity. And so that puts the public at risk. And we're going to let Dr. Porsa talk about the statistics, but I can tell you that there's a recommendation by the American Academy of Thoracic Surgeons, I think. They, Andrea, estimate that you need 1 level 1 trauma center per 1 million residents. Mm-hmm. And Harris County is going to be approaching 6 million population
Correct.
soon. So, you know, we have to think about the safety of our families and our children. They may be driving. Your son goes to Texas A&M, comes in on Highway 6, comes in on 290. If there's an accident, you want first-class care for your child.
Absolutely.
And it should be frightening to all of us that, we're in such... People think that we're the world's largest medical center. We have all this great... When we do, we have great medical facilities and great medical care. But that's if you make an appointment with your doctor and you get some, CT scans.
And you get lucky to get the appointment, by the way.
But if it's a life-threatening emergency, you need medical attention immediately. Yeah. So Dr. Porsa, welcome to the program. How are you today?
I'm well. Thank you for asking. Hopefully y'all can hear me okay.
We hear you fine. So Dr. Porsa, talk to us a little bit. First of all, we always like to start with a bio. So in about a minute, tell us a little bit about who Dr. Porsa is.
Sure. First and foremost, thank you for having me on this call. I'm a physician by training. I always start by saying that almost 30 years ago, I actually did my training at Harris Health System, similar to almost 50% of all the physicians who are currently licensed to practice medicine in Harris County, which is a really important fact. After my training, I worked inside the Harris County Jail, actually, took care of inmates for 10 years. Moved to Dallas, joined Parkland Health and Hospital System, which is their safety net hospital in Dallas County, and was blessed to return back to Houston in March of 2020. In my current role as president and CEO of Harris Health System. I'm married to my wife for more than 30 years. We have 3 grown children. My oldest one is actually finishing her residency in psychiatry at Harris Health System. So it's a blessing to be in the city of Houston in Harris County.
All right, so now let's get to the nitty-gritty. Election coming up, and the Harris County Commissioner's Court has authorized Harris Health to issue $2.5 billion worth of bonds. What are we going to use the $2.5 billion for?
Sure, I can break it down for you. The current proposal is $1.6 billion toward a new hospital an adult level 1 trauma center hospital on the LBJ campus. To your point, and you're exactly right, Harris County, with a population of 5 million, soon to be 6 million, needs at least 5 adult level 1 trauma centers. We currently have 2 attached to each other in the Texas Medical Center. Not an ideal situation to serve the needs of Harris County that is continuing to grow. In addition to that, $400 million towards rehabilitation of the existing LBJ hospital, turning it into some of the services that we currently do not have access to. And Mr. Sanchez, I don't know if you noticed or not, this news just came out today that, as you may know, Harris County, City of Houston, is in desperate needs of additional psychiatric beds. There are very little of them for the great needs of Harris County. And without mentioning any names, one of the hospitals is closing down their entire psychiatric program. That's 100 beds that are soon going to be off the market at the end of this month or next month. I say that because that $400 million refurbishing of the existing LBJ hospital is to transform it into a inpatient, emergency, and outpatient psychiatric facility, which again, Harris County desperately needs. On top of that, $400 million toward expansion of the capacity at Bentop Hospital, our current level 1 trauma center, and almost $500 million in expanding our capabilities and capacities in our community clinics. That includes 3 new clinics in Harris County.
So, Dr. Porsa, in that plan, I didn't hear, did you say any is expanding, it's everything but in the current facilities, but nothing new and not a new facility?
No. So the level 1 trauma center on the LBJ campus is a new facility. If everything goes well and the hospital opens its doors in 2028, which is our current plan, that new hospital will have almost twice the capacity of today's LBJ hospital, which is only 200 beds. So that hospital is going to open its doors with 390 hospital beds, but having the capability to increase its capacity to 450.
But again, it's next to each other. They're next to each other, right?
They're on the same campus. Yes, correct. That is correct. The expansion of the Bentop Hospital, that's a new tower with 120 additional hospital beds, adding to its capacity. And in the clinic, in the community, there are 3 net new clinics, but there's also replacement, some of our existing clinics that are over 50 years old.
Wow.
So let's talk a little bit about the fiscal operations of Harris Health. The Harris County Harris Health is funded through property taxes. Every year we get a tax bill, and when you look at your tax bill, there's property taxes for the city of Houston, property taxes for the Houston Independent School District, and there's property taxes for Harris County, the Flood Control District, and if you're in a MUD, they probably included there. And you will also see the Port of Houston, and you will see Harris Health. Now, Harris Health, it's my understanding, Dr. Porsa, correct me if I'm wrong, has not come to the public in a long time to ask to borrow money to expand the operations. Is that true?
Well, I'm going to correct you. So that's not true. It's not that we haven't gone to the public in a long time. We have never gone to the public. So this is the first time in the history of Harris Health System, the 60-year history, that Harris Health System is going to the public, and which is very, very unusual. For those who may not be familiar, in a public health system, when you look at other large health systems in Texas, Dallas, El Paso, Bexar County, the routine is that every 10, 15 years, the public health system goes to the public, asks for a bond referendum so they can invest in the infrastructure, both replacing the existing infrastructure and creating new. Harris Health System has never done that, so this would be a first.
And let me also say, sort of an editorial comment, that, when we borrow money, there are 2 types of bonds that we issue. There are general obligation bonds, which are guaranteed by your property taxes, and then there's revenue bonds that are not guaranteed by your property taxes. Those are like bonds issued for sports arenas and hotels that the city of Houston has built, for example. But general obligation bonds are guaranteed by your property value and your taxes. So they're safe. We as a government entity, we get a very low interest rate, so that should not alarm people. But we pass all kinds of bond issues. You know, we passed billions of dollars for the expansion of HISD. We passed bonds to build 3 sports arenas in Houston that cost multi-billions of dollars. So this bond, for example, deals with the health and safety of the residents of Houston and Harris County. So we need to think about this. And as I said, I rarely support, bond issues, but unless they're infrastructure and public safety, this one I'm supporting and I'm voting for. I just want to make that perfectly clear. And as you know, I'm the past county treasurer of Harris County, so I have a pretty good understanding of the financial operations. At least I did. And so this is a very important bond issue that will affect every family in Houston and Harris County. Now, Dr. Porsa, by comparison, because you have had the opportunity to work both in Dallas and Harris County, tell us how we compare to Dallas County in terms of level 1 trauma centers.
Well, I'll do that. Then I also want to expand on what you just said, which is really important, and that is the impact of Harris Health System on the entire community. First, to answer your question, so Dallas County, with a population of almost 2.5 million, almost half of Harris County, they have 4 adult level 1 trauma centers. So right off the bat, there's a discrepancy. But that goes to the point that I want to make, which is the role of Harris Health System. Yes, we are the public health system. Yes, we are in charge, and we are proud of the fact that it is our mission to care for the uninsured and underinsured, which are really the foundation to the economy of Harris County. But in addition to that, like you mentioned, through our level 1 trauma center, Bentop Hospital, level 3 trauma center, LBJ Hospital, we provide services to the entire community when they need us the most. On top of that, I think you know this, but it's really important to mention here, we are the training grounds for the current and future doctors that serve this community. Through UT Health, McGovern Medical School, and Baylor College of Medicine, I think I mentioned that at the top of our conversation, that almost half of all the doctors who currently are licensed to practice medicine in Harris County received their training at Harris Health System. So even though whoever is listening to this call, you may not use Harris Health System facilities for the healthcare that you receive or your family receives, chances are half of the people who are listening to this conversation, their doctors received their training at Harris Health System. So you may not be the direct recipient of services, but you are indirectly impacted by the care and the services that Harris Health System provides.
But it's just not physicians, right? I understand that you also do training and practical experience for those seeking to get a degree as registered nurses, probably in OB-GYN and cardiology in the operating room and trauma care, right? So not only do doctors get trained, but also a lot of our nursing staff in Houston, Harris County get trained there.
Yeah, we are currently actually in relationship with 40 different nursing schools. We train techs, surgical techs, radiology techs. We also train nurse practitioners and physician assistants. So you're correct. It's not just the physicians, it's literally the entire gamut of healthcare services where people are receiving valuable training, hands-on training at Harris Health System.
So I think very important also to understand what that means for taxpayers, because it's not only voting for that. So people will say like, okay, how much that's going to cost me? How did that works? Especially that people don't understand how did these issues, and people don't pay attention. Normally when they go to vote, they vote for candidates, they vote for positions, and they hardly understand these bond referendums. So I wanted you guys, give us a spectrum of how it's going to impact the taxpayers.
Thank you for that question. That's really, really important. So the impact of the entire $2.5 billion bond proposal on an average homeowner in Harris County, somebody who has a home valued at $300,000, for example, That's about $6 a month or $70 a year. That's the entire impact of the $2.5 billion bond proposal. That's really important. And the reason for that, I'm not going to make light of the $6 a month. $6 a month is still $6 a month, $70 a year. I'm not saying that that is not money. It is money. But it is an investment in the future health of Harris County, not just the indigent. Like I said, this is something that is going to impact every single one of us. And not just in terms of the value that folks are going to receive through healthcare, but the overall cost of healthcare is actually held back, is held down because of Harris Health System, because of the value that we bring to the table, by being able to take care of the folks who otherwise will have to go to our non-for-profit or for-profit hospitals. And that cost, if the situation would arise to that point, would have to be escalated to private insurance companies. Those private insurance companies will then have to actually pass down that cost to folks who are listening to this broadcast, you and I, who have private health insurance. That would be transmitted to us through higher health insurance premiums, higher out-of-pocket deductibles, and things of that nature. So when I say foundational, I really mean that the services that Harris Health System provides in this community is foundational to the entire healthcare ecosystem of Harris County.
One of the things that comes up quite often, Dr. Porsa, is we have to recognize the environment that we live in today. And that is, given Houston's geographic location to the border, we understand about illegal immigration. Houston bears the brunt of it. Texas bears the brunt of it. So many people, particularly conservatives, have this question. Are we going to provide health care services and emergency health care services to illegal aliens? And I want to preface that question with a fact. And I'm not, anyone that knows me knows that I am for border security, making sure that everybody follows the law, follows the rules, and I don't want to get into immigration. But what I want to say is there's a law, it's called EMTALA, and basically the federal courts through the Supreme Court have decided that when a patient presents themselves to an emergency room anywhere in the United States, regardless of legal status, you have to treat them. You have to stabilize them. And so we are no different in Harris County. Yes, we have a lot of undocumented aliens. And people will say, well, why should I pay $6 a month to provide health care to illegal aliens? Well, first of all, let me make this comment. Everybody that lives in Houston pays property taxes, whether you're legal or illegal. Mm-hmm. Your property taxes, portion of that goes to Harris Health. So you're really not taking care of people that aren't contributing. And I know that question comes up from a lot of folks on the conservative side, but everybody's paying into the system. And it's true, right, Dr. Porsa? You have to treat everyone that presents themselves with a life-threatening situation at the ER.
That's exactly right. And let me expand on that. You're absolutely right. There is a law called EMTALA that obligates all health systems, public, non-public, non-for-profit, for-profit. If somebody shows up to your emergency room in an emergent condition, you are required by law to provide services to them, regardless of their ability to pay and regardless of their legal status in the country, number one. Number two, you're absolutely correct. Just because you may be here undocumented doesn't mean that you are not paying property taxes. If you're a property owner, you are. But really important, Mr. Sanchez, is because this also comes out that you're providing free services or free care to all these undocumented illegal aliens, whatnot. And this is really important for folks to understand. When outside of the emergency room, when folks show up to our clinics, there is no such thing as free service. Yes, you may pay less on the sliding scale based on your income level, but regardless of your legal status or what else, when you show up to our clinics, you pay to get in through the door. The folks who are receiving indigent care, a requirement for them is that they have to be legal residents of Texas, United States, or citizens of the United States. So folks may be familiar with Gold Card. You cannot get a Gold Card. You do not qualify for indigent health services at Harris Health System if you're an illegal alien, if you're here undocumented. And otherwise, and unless you show up to the emergency room, you will pay for the services that you're receiving at Harris Health System.
Yeah, and let me also say, Andrea, because that's, we have to be cognizant of the fact that we do have a lot of undocumented aliens that don't have health insurance and have very limited resources. And as Dr. Porsa says, outside of a life-threatening presentation at an emergency room, you can't just walk to Harris Health and say, "Hey, I need, I need medication for my diabetes, or I have a pneumonia and I need some antibiotics." No. But what we have in Harris County is a series of what we call federally qualified health clinics. And there are a lot of nonprofit organizations that provide either free health care because donors have donated money for that, or they work in combination with donors and the federal government that subsidize that health care. So it's not as if there is no health care for the indigent and the poor. It's just the taxpayers don't provide that health care. Is that a pretty good assessment?
And that is, and part of it, I just want to be very clear. So, you're an indigent, you're uninsured or underinsured legal resident or a citizen of the United States. If you qualify for patient financial assistance, that's what we call it at Harris Health System, yes, you receive either free or very, very cheap, low cost health services. But again, that requires you to have a legal status in the United States. If you happen to be an undocumented person, you show up to one of our clinics, like I said, you pay for the services you're going to receive at a sliding scale, and you're correct. And that's one of the blessings of being in Harris County, City of Houston. We have a very strong presence of what we call the FQHCs, the federally qualified health centers, and also some faith-based and non-faith-based charity health centers as well, that in connection with Harris Health System are able to provide the services to folks who fall out of the categories that I just described.
So again, Andrea, just for recap, increase level 1 capacity, increase the number of psychiatric beds, increase the number of beds for general health care, and rehabilitate a lot of the buildings that are pretty old that need, physical plant rehabilitation. So to me, this is a reasonable request by Harris Health to the taxpayers to approve this bond issue because it's going to benefit us. But I will also say that I remember when County Judge Emmett was in office, he was a big advocate for psychiatric health care, mental health care. And as we know, and Dr. Porsa can expand on this because, as he said, he spent a long time at the Harris County Jail. Unfortunately, the jail has become a holding cell for people that really don't need to be in the criminal justice system. What they really need is psychiatric help.
Yeah.
And I mean, even our own county judge has had to, publicly admitted she needs, some mental health assistance. So mental health is a big issue, and
especially after the pandemic become a biggest issue. So that's why of course, nobody will understand why they're closing one of the facilities that you were mentioning.
Yeah, I mean, it is really unfortunate. I was shocked to hear this morning that, as bad as it is currently in Harris County instead of Houston, as far as access to mental health services, that this hospital is shutting down the entire program. 100 beds are going off service. This is going to impact us. And, why psychiatric care? And I can tell you that today, for example, when folks with acute psychiatric issues show up to our emergency rooms and emergency room at the LBJ hospital, we do not have access to inpatient or acute psychiatric care at the LBJ hospital. they will unfortunately have to stay in our emergency room until we can find a bed for them somewhere in the community. As you can imagine, they're probably not high on the list of anybody who's currently providing inpatient psychiatric services. So there are times when people in acute psychiatric crisis end up staying in the emergency room for a day, 2 days, maybe 3 days. And that is like the worst situation for somebody who's suffering to be
Yeah.
in a stretcher in the emergency room. So really, really important of all the things that I have mentioned, of all the plans that we have, the extension of the current LBJ hospital into transforming it into an inpatient psychiatric facility is probably one of the one of the biggest things that I'm looking forward to, because this community needs it desperately. Our patients need it desperately.
Absolutely. And another question I have, in case that in November the taxpayer decide to approve this bond, how long is going to take for all this project to be done?
Sure. This is a 12-year plan. The first thing that will start, just because we have been actually planning on this for about a year and a half now, is that we will break ground on the new hospital, the new Level 1 Trauma Center hospital on the LBJ campus, sometime around March, April of next year. So that'll be the first thing. And then sometime after that, we will start working on our clinics and also on the Bentop Hospital. Just recently, last week actually, we presented a detailed plan of when things are going to happen over the next 10 or 12 years to the Commissioner's Court. So we have that schematic as well. But like I said, this is a 12-year plan. Not everything is going to happen at once. We are not going to take out $2.5 billion if we are fortunate enough for the residents of the county to approve this bond proposal on November 7th. We are not going to take out $2.5 billion on November 8th. It's going to take us a few years to actually draw that money down.
All right, Dr. Porsa. Well, look, we're always available for you. If anything comes up before now and the election, please let us know, and we'll have you back on. We would perhaps, Andrea and I will probably do something in Spanish to educate
I think we should
Spanish-speaking community.
We should do a program like this in Spanish. It's very important for the Hispanic community to understand that these issues, because in our countries the elections, it works different, especially on these issues. So I think it's very important to understand these issues in Spanish for the Hispanic voters. But Dr. Porsa, call to action. What we need to tell our community that this coming November election, why is so important this bond referendum?
This is not a burden. This should not be looked at as an expense. This is an investment in the future health of our county and of our residents. This is not about providing care to the indigent, but this is about providing care for the entire Harris County and the city of Houston community, and providing an environment for our employees and our current and future doctors, nurses, and techs to receive the training that they need so they can serve the members of this community. That's why.
So, Dr. Porsa, thank you. We know you're busy. You have a very busy speaking schedule. We wish you the very best. I will be voting for the bond issue. I encourage all of our viewers and listeners, if you have questions, please feel free to reach out to us. I know Harris Health has probably, is there a telephone line, or if people have questions about the bond issue, can they call?
Yeah, so actually they're on our website at harrishealth.org. We have the bond book already in electronic format on the website. There is a number for them to call. There is the frequently asked questions that is available on our website that people can look. And if there are other questions, obviously they can send those questions to us as well. We are always happy to enter a dialogue.
All right. Early voting starts October 23rd. The bond issue will be on the ballot. Election day is November 7th. I'm voting for the bond issue. I hope you do too. Dr. Porsa, thank you for your time, and we'll see you soon down the road.
Thank you so much for having me. I appreciate it.
Take care. Mm-hmm.
Thank you. We definitely need to do this show in Spanish, half an hour, and explain very well.
my dear friend who works for Dr. Porsa and Harris Health, Olga Rodriguez. Maybe we'll have her on, or someone that Dr. Porsa designates that's bilingual that can come on the show. And we can talk about it for a few minutes in Spanish because it is very important. All right. Speaking of healthcare, as you know, I'm on the board of a hospital, so I've got to run. I've got a hospital board meeting today. And well, I'm going to let you close it.
No, we're going to close it together.
Oh, we're going to close it together. Thanks for tuning in. Remember, if you want to make a contribution to Texas Latino Conservatives, go to our website, texaslatinoconservatives.com, hit the donate button, stay in touch, sign up for our newsletter, share our website with your friends, and we'll see you next week.
And follow us in social media and stay tuned for next Wednesday. Nos vemos el próximo miércoles. Chao, chao.